So I think most of you know I'm Kathi Tunheim, and Bob and I have been members here for 20, some years. And we are just so pleased to welcome a friend of ours. Andrea Walsh is the CEO of Health Partners, and she and Bob went to law school together at the University of Minnesota 40 years ago. And that very first semester, they were in the same study group. Is that the term? Right. So anyway, we've been friends. Section, yeah. That's the right term, yeah. My academic background is not in legal, as you can tell, not at law school. But anyway, Andrea was very willing to come to Trinity and talk about her faith background and her career journey. And what we know about Andrea is that she has led in different sectors with care and a deep sense of purpose. And I think you'll see that as she tells her story this morning. So what I'm going to do for about 30 minutes is ask about her background. I wanted you to hear about her personal side first, and then we'll get into a little bit more of her professional background, if that's okay. And we'll take some questions. Bob is telling me that I'm not loud enough. Is that better? With my teacher voice, I'm always worried I'm going to speak too loudly, so thanks for the feedback. So let's get started.
What's a good spouse for, right?
Exactly. So let's just first ask, Andrea, could you talk about your growing up years? Sure. And where'd you go to school, and how did you wind up where you are now?
Thanks, Kathi. And first of all, it's just really great to be here. I appreciate the opportunity to share a little bit. And it's really fun to reconnect with a number of friends here in the congregation as well. So I grew up in Rochester, Minnesota. I am the oldest of 4 kids. My dad was a physician at Mayo, a nephrologist, and my mom ran a real estate company. And so I was influenced as a child growing up in a household with 2 working parents in a family that really values education and learning. In addition to the influence of my parents, I was lucky. I had my 4 grandparents who were with us until I was an adult. Wow. And I had 2 strong grandmothers who, in their own way, really influenced me as a person and influenced my faith as well. So my dad in particular, I grew up at First Presbyterian Church in Rochester, Minnesota, and my parents both raised all of us at First Presbyterian Church. My dad had a keen interest, though, in all religions, so he did a lot of reading on other religions, and so as a kid you watch that and are curious about that. My grandmother on my dad's side was a writer and an artist, and so her faith showed up in some non-traditional ways, but she was Christian with a curiosity again for the influence of religions outside of Christianity. My grandmother on my mom's side was a good Methodist kid, and the daily word was part of her daily ritual. And so as a child, she would get this little packet, a daily word, that month by month gave her morning devotional. For me, honestly, my faith was influenced probably as much, though, as a youngster by Young Life. So a really strong Young Life program in Rochester. And so I was blessed in high school to be able to go to Young Life camp, and it really was a time of fellowship and fun, and introduced me to a bunch of friends who held faith in ways that sometimes as youngsters you don't have. So that was great. When I graduated from high school, I went to the University of Kansas and majored in business and English, then went on to law school at the University of Minnesota, which is where I met Bob and you. I married my college sweetheart. We've been married now 39 years, so Bob and Kathi were one of the young married couples in law school. Tim and I were the other. Mm-hmm. We've raised 3 kids in Edina, where we've been members of Christ Presbyterian Church, and today we also have 2 grandkids, Henry and Charlie, who are 5 and 2.5.
Just great. Well, thank you. Wonderful start. So what prompted you to leave your career as a lawyer in private practice to take some other positions?
So when I graduated from law school, I began my career in law and in a litigation practice at Ryder Bennett, which was really interesting, and I liked it. I did a lot of insurance defense work. One of the partners in the law firm approached me after Arnie Carlson was elected governor in kind of a fluky election. He was the state auditor and was elected after running for a very short time period. And at that point in time, the Carlson administration was looking for a female lawyer for an appointment to the Minnesota Health Department. And one of the partners in the law firm said, hey, I think you should give that a run. And you could come back and practice law when you're done at the health department, but why don't you give it a try? And I was lucky in that opportunity opened me up to something I would have never on my own seen as an opportunity. And throughout my career, it became sort of a story of taking opportunities that you might not see yourself, but trusting those around you and saying yes to opportunities to do different things when they sound interesting to you.
That's great. So how long were you there? Was it through one term?
I was, for about 3 years, so not quite through a whole term. So I'd been at the law firm for about 4 years. Then I went to the Minnesota Health Department. I was there for about 3 years. And then I went back into practice law for about a year. And then George Halverson, who was the CEO at Health Partners at the time, reached out and asked if I would consider coming in-house at Health Partners. And at the time, I was thinking I would stay in private practice, but the opportunity to really go into an organization, I think at the health department, my passion around health and well-being, my passion around serving others and making a difference was opened up in a way that for me, it felt like going to Health Partners would enable me to contribute to the well-being of people in a different way than the practice of law.
So you started, was it in communications at HP?
I started actually in government and community relations, and then moved into the general counsel and compliance officer role, as well as government and community relations. I was in those roles for about 6 or 7 years. I actually then took a few years off. I left the executive track and went home. Our 3 kids were tiny. My husband was traveling all the time, and I just felt like I couldn't be a good parent and a good executive, and something needed to give, and I didn't want it to be my sanity. So I stepped off that track, and I worked from home, and I discovered a lot about myself in that time period. I discovered I'm a much better mother when I'm working, and I'm much happier as a person when I feel like I'm taking my God-given talents and putting them to use in a way that enables you to be a good parent and a good professional. And so when Mary Brainerd became the CEO, she invited me back to Health Partners in the role of Chief Marketing Officer.
Yes.
And much like moving to the Health Department, being the Chief Marketing Officer was a role that on paper I wouldn't be qualified for. I'm not sure actually I was qualified for it when I took it, but I learned a lot, and I was able to surround myself with some really great team members who knew marketing, and I learned a lot over 15 years as the Chief Marketing Officer at Health Partners.
Great. So learnings, let's pick up on that thread. How long have you been the CEO now, and what have you learned in the role, or what has surprised you?
Yeah, great question. So I've been at Health Partners for 32 years now, which is hard to believe.
Yeah.
I was the Chief Marketing Officer for 15, and I've been the CEO since 2017.
Okay.
So for a little bit of time now. I think for me, as the Chief Marketing Officer, my focus was really external, really focusing on patient and member experience, focusing on how can we make sure that our health system shows up in a way where whether you get care from us or you have one of our health plan products, you're having a great experience. And what does innovation and design look like? And I loved that external focus. I would say as the CEO, one of my biggest learnings has been the importance of culture and the importance of tending to what's inside the organization as well. And in the CEO role, it's externally focused to be sure, but the enabler to the external focus and external success is the people in the organization. So you can have great purpose, but if you don't have people and a team that really builds the kind of culture that delivers on the experience that patients and members want and need, you don't get the job done. So I think I'd say the biggest lessons for me have been around culture and around engagement and what it takes to really drive change.
Well, it's kind of been an interesting time in healthcare, right? If we pay attention to the news and read the paper, there have been some challenging moments, right? Including community tragedies, COVID, political division, and more. How have you stayed grounded and connected through these challenging times? I know there wasn't a nursing strike this last year. That was good news. But what practices or routines have helped you along the way?
I mean, for me personally, that is in part where faith plays a super big role. Because I firmly believe that oftentimes the challenges we face, whether it's individual or as a society, stem from the fact that, we get these reminders we're not in control. And as human beings, we just yearn to control. We yearn to be on top of it. And so I kind of approach the challenges we have in the industry, the challenges in an organization, or the challenges in family life are just that reminder from God, you're not in control, and it's okay. Because at the end of the day, if you do your best and bring everything you have, God takes care of the rest. And your plan and His plan may not always be the same plan, but that's all right. I also think that you learn so much from challenges and that ability to accept ambiguity. And I think right now we're in a time of such huge ambiguity. You think about faith and you think about the way Jesus Christ approaches how He lived out the lesson. I mean, faith in action, I think, is how each of us show up individually. So I just try to take from that the lesson of it's how you show up personally, and you get to choose. You don't get to choose the circumstance, but you do get to choose how you react to it.
Right, yes. I'll just share that I had the opportunity to speak with one of our vice presidents this last week, getting ready for today. And this individual, whom I have never met, said, I have worked with and for Andrea for 14 or 15 years, and the thing I'm so impressed about her is she's always so positive. No matter what is going on externally or internally at our company, she is always kind of that positive leader. So I think that really has shown up in your entire 32-year career, and from our personal experience of you the same.
Kathy, I think one thing I would share is I feel like that's one of my favorite Bible verses is Philippians 4, verses 4 to 9.
Yeah.
And basically that segment is all about it's life. It's like rejoice, be happy, and be faithful in God. Don't be anxious about anything, but put your trust in God. Focus on positive. I mean, that verse is all about focusing on the things that are good.
Yeah.
And so often it's easy as human beings to go to the dark, but focusing on things that are good helps you in not being anxious about those things that are not good, and there are plenty of not good things.
Right.
And that then God gives you peace and helps you navigate. So I feel like the gift of God and the gift of that deep-seated faith is what helps keep faith and keep positivity.
Mm-hmm. Such wise words for me, hopefully for you too. Maybe my last question for you, and then we're going to open it up to the floor here, is where is healthcare headed, in your humble opinion?
Yeah.
Just curious what you might think is going to happen here down the road.
I think, honestly, you talk about challenges. Healthcare and our industry is in a huge challenge. So, the next 5 to 10 years, definitely financial challenges are going to continue. The government, state, and federal government reimbursement levels don't cover the costs of delivering care. And the state and federal government's not likely to pay more than what they're paying. It already is a big portion of the GDP. So that means it's going to be a time of transformation and change. Workforce shortages. You think about the baby boomers aging. There are more people sick. There are more people in need of care. And there are fewer people of working age period much less dedicating their careers and their professions to healthcare. So there's going to be a lot of workforce challenges that are going to face the industry. And so it's going to be a time of a lot of innovation and change, which can be, it's both challenging, also exciting. I mean, I see at Health Partners, we have teams engaged in looking at how can we deliver care to produce better quality, better health outcomes in a less expensive way. I mean, our industry, like lots of industries, has waste and rework. We don't do things perfectly. So figuring out, like, how can we be part of the solution instead of part of the challenge? I'd say the other thing is technology, and artificial intelligence is definitely going to be an enabler and a positive for us, despite the fact we don't know all of the potential it has. I think of a couple of things as live examples that are happening at Health Partners right now that give me great hope, both for building healthy culture and confronting and addressing and enabling change. So ambient dictation, we have a new tool we're implementing across our medical group, and it enables our clinicians to spend time in relationship, in healing relationship with the people that we serve, while the machine is recording the office visit, and the machine can take and transcribe essentially the visit into the clinical notes that enable capturing what's clinically relevant, so the next time that the doctor sees you as a patient, the information is there, and translating it into the documentation necessary for billing, so that it will be an efficiency in administrative practice. I mean, anything we can do in healthcare that will drive down administrative expense so dollars can be spent on provision of care is a positive. So that's one example. A second example I'm very excited about is in the area of oncology or cancer care. There are so many clinical trials going on across the country right now. And when somebody is diagnosed with cancer and a regular treatment protocol is not going to do the trick, our clinician and our care team spend a lot of time trying to match a patient to a clinical study. And right now you do it the old-fashioned way, which is who are the relationships you have? What can you find out through computer search? It takes a lot of time. We're using a new tool now at Health Partners that enables our clinicians and care teams at a glance to be able to access the clinical trials underway across the entire country. Moreover, to take the patients, to better match the patient indications with that clinical trial, so that we save people the heartache and the time and energy of a mismatch, of searching out, thinking maybe this trial will work, maybe it won't. And so 2 examples that are live right now. I think we don't fully know the impact of all the other ways that technology will enable and drive change, but I think it holds great potential for advancing science and medicine.
Absolutely.
Yeah.
Well, thank you very much for my session here. Let me now take this microphone, and 2 things before I open it up to all of you. Number 1 is that she's going to the Vikings game, like maybe a couple of you in here, so we're going to keep this about 10 minutes, all right? And number 2 is...
And Bob might be going too.
Yeah.
I just have to...
I think he's got his jersey in the car, yeah. Blazer off jersey in. And the second thing is I think there's always a tendency for those of us, when we talk to people about healthcare, is to ask about our own particular situation. I just retired, so I'm Medicare Advantage. What's going to happen, right? So she has kindly offered that if you do have personal questions, to maybe come up afterwards, and she can take your name, and somebody on her team can follow up. And that's already happened with this couple in our church that couldn't be here today. And boy, those people are right on it. So if you have a particular question about your situation, she'll help, but maybe not in front of the whole audience. Fair? Okay, with that, who's got a question? Oh, good, thank you. Get us started. Yeah. Excuse me.
We've been with partner.
You know what? I don't think it's working. Let me try it again. I did it wrong. Does this work?
It works. Thank you. My wife and I have been with Park Nicollet for 40 years. We've had outstanding care, and we thank you for that. And we see the culture with your frontline physicians and nurses every day, and it's wonderful. So thank you.
Thank you.
Great work.
Thank you. Yeah, and actually maybe it's worth a mention, I didn't talk about who is Health Partners. And I think for many people, like healthcare is complicated and there's so many healthcare brands in the marketplace. So Health Partners, we are a large multi-specialty group practice. So we've got 3,500 clinicians that practice across our organization in a lot of clinics. Health Partners is Health Partners. Park Nicollet is Health Partners. TRIA is Health Partners. The Melrose Eating Disorder clinics are Health Partners. We have 8 hospitals. Methodist Hospital is the closest here that is Health Partners. And so we are an organization that's grown over the years to serve communities as far west into central Minnesota as Olivia, Minnesota, Hutchinson, Minnesota, and then as far east into Wisconsin, Amory, New Richmond, and Hudson. So thank you. I appreciate your comments, and it's helpful to know. I mean, our care teams do amazing work. We are the quality leader in the community, so I'm glad to hear your experience has been a good one.
Thanks. Great. Who's next? Oh, good. Pastor Adam. You probably are going to ask about Medicare too, right?
That's right.
You can ask about Medicare. It's okay.
All right, yeah, I got lots of questions about that.
You don't look like you need Medicare.
Not quite yet, but I'm closer than I was before. But anyway, you mentioned a time of innovation and change, and I'm curious from a leadership standpoint, when you know that innovation and change needs to come, but people don't stop coming to the clinics right now, right? And people want change to healthcare right now, and that everyday part doesn't stop. How do you do that? And how do you make little progress on maybe something big every day? I'm curious how that works as you're thinking about something that might be further down the line.
Great question. I mean, we're an organization. We have about 28,000 people who work in our organization, and to affect change, you need involvement and engagement of the team. You can't, a great idea is only that. So it really is how do you pull together people? How do you be clear about what's the problem we need to solve? I think as a leader, that's one of the most important jobs, is how do you have clarity around what needs to be solved? And then how do you enable people to come up with solutions so that you can try new things, fail fast and redirect? But part of culture is how do you create a growth mindset? How do you create a mindset in the people in the organization so that folks feel enabled and empowered and expected to help drive the change that needs to happen? It can be hard. I would say right now, frankly, our industry is under such pressure. I don't think many of our people would expect status quo is doable. So it's a unique time where you can lead change and you can affect change easier than we're in a status quo environment where people feel like everything's going right, so why do I need to change? That's not the environment we've been in for a while. I would say the pandemic taught me a lot and taught our team a lot. It was a time of a lot of ambiguity and uncertainty, and we drove innovation and change because we had to. And now the pandemic is long gone, but I think for people in healthcare, it never will go away, because what we experienced in that time really leaves a mark, and we learned that we could change much faster than we thought we could. So it's emboldened us to change faster and really answer that calling of we have to change faster, because healthcare is too expensive for too many people. It's unattainable for too many people. I think the biggest change that we have to figure out how to tackle is really health, not care, because when you look at what drives health, we're at the back, we're at the tail end. By the time patients and members are coming to us, it's for sickness, not for health. And so we help get people back on the road to health. One of our roles as a health plan and as a care delivery system is to help people think about health and to shape and support health. But I think too many people don't realize the power we have as individuals to really affect the greatest thing of all, health, by the behaviors, what we do or don't do. And that's the change I wish, if I could wave a wand and say, gosh, there's one change that I could personally make happen, it would be to help people tend to that part upstream.
Maybe this is a selfish question, but like whenever we have the different clinics that we go to, you know, for my kids, or there's a foot problem, whatever, there's different portals. And
Yeah.
I'm wondering, do we ever foresee that all of the different, you know, health organizations can be on one portal instead of, you know, I've got like 5.
Yeah, I think your point is really a great one. I appreciate that question. I think far too often for people, care is disconnected. The body is all one. So, you know, the ability to treat all parts and to have a sense as a patient as to how and what the interconnection is really important. I think one of the opportunities we have at Health Partners that is unique is we have a care delivery system that literally provides all kinds of care except transplant. And so your care doesn't have to be disconnected. If you go to Health Partners for all of your care, it will show up in a unified single record. Moreover, if you carry our card and get your coverage, your health insurance, and your care from us, we can serve up and use our digital services to create an integrated experience. And part of it is to get after exactly what you're talking about. That said, we know a lot of people like to get care from folks they've gotten care from for a long time, or like to go to single specialties for certain care. And so that there are those natural disconnections. We're trying to build, using technology and AI, the ability to integrate it so that it does connect. There's a big federal movement going on right now called interoperability, where there's an effort underway to connect all of the data across care delivery and health plans so that it hooks up in a way that would enable you as a patient to have better line of sight. I feel like at Health Partners, we have an opportunity to lead in that space. What it requires is patients to come to us for all of their care, not just piecemeal parts. Yeah.
We hear in the news about the disputes with negotiations between providers and insurance companies. Since you're both a provider and an insurance company,
Yeah.
what insights do you have about the negotiations between those groups? How do you negotiate with yourself?
Yeah, great question, and I think it gives us a fantastic opportunity because we don't have the luxury of pointing fingers at one part of the system or another. I mean, the reality of it is health insurance companies exist to try to pool risk and pool expense so that it can spread across a population, and health insurance companies exist to try to help care be more affordable through negotiation of rate. I think the challenge comes when the rate is insufficient to cover cost. And I think from a care delivery standpoint, it's really frustrating to negotiate with health plans and talk about why bills aren't being paid for care that should be covered by the insurance plan, should be paid for by the insurance plan. And the reality is that we need better administrative process and practice so that there aren't barriers. There's not barriers between people being able to access care and have it paid for as coverage intends. I think from Health Partners' vantage point, we look at how can we integrate care and coverage so patients and members don't get caught in the middle. We don't do it perfectly, but that's the quest we're on. And I think we are a better care delivery system because we have a health plan that's part of our organization, and we understand the pain points for employers. We understand the fact that the federal government feels like its GDP at 22% being spent on health care is enough. So we feel a responsibility for affordability maybe differently than if we were only a care delivery system. I would say likewise as a health plan, we try to lead the way and show up in ways for our contracted network that demonstrate our commitment and our understanding that payment sources shouldn't be what gets in the way from patients being able to access the care that's needed.
Thank you. Well, I think we could probably be here another half hour, but we just say thank you for showing up today. Let's show our appreciation for Andrea. Thank you so much. Okay, so are you rooting for the Vikings or the Ravens?
Skol Vikings, right? Yeah.
Thank you. Thank you. Have a great week, everybody. See you next week.